Women's preferences for birth control might surprise you. In fact, permanent birth control is now the most common method of contraception. Here to talk more about the options that you have is OBGYN Dr. Hector Chapa. Dr. Chapa, how are you?
I'm doing great. Thank you for having me.
Well, thanks so much for coming on. So first things first, let's talk about why a woman or what age a woman might decide about some permanent birth control as opposed to some other contraception methods.
No, absolutely. And that's a great place to start because I want to be very clear about the direction where we're going right here. This is permanent birth control. In other words, once a woman, ideally obviously a couple, is aware, 100% committed, and knows that their family is complete, they're done with childbearing, that's where permanent birth control has its place. Now, the question as to why somebody would actually choose permanent birth control is actually given in a recent study that found this. All right, so 1,000 women were asked if they're done having children, and 80% of those in the late 20s to the late 40s said they were done. Now, out of those who were done with their childbearing, here are the main reasons why they chose permanent birth control. Number one, they wanted something that was hassle-free. That makes sense. Two, they wanted something that was hormone-free, since there's obviously some concerns, some fears about hormones entering the body long-term. But most importantly is this. They wanted something that was dependable, reliable, that didn't interrupt or interfere with their daily activities. That's why somebody would choose a permanent birth control option.
Well, Dr. Chapa, you were talking about some of those options. Are there differences between the different birth control options?
Yeah, you know, historically, there was two main camps, two main treatments for permanent birth control. One was tubal ligation for the woman, and most women or most people have heard about this. It is an office trip. It is under general anesthesia and requires an incision, with its recovery time, of course. For the male, same thing. I'm sure most people have heard of the vasectomy. And even though that's done in the office setting, it still requires an incision. Well, since 2002, as medicine has progressed, there's now minimally invasive ways for women to get permanent birth control, and here's what that means. Minimally invasive simply means it can be done in the office setting, now here it is, with little to no anesthesia and no incision. That's why permanent birth control is now more accessible than ever. So I want to be very clear and just stop right here for a minute and make sure that everybody is aware that that's what I'm trying to do, is educate everybody on this procedure. It's called Essure. And so I'm here on behalf of Essure through Conceptus to get this word out.
All right, well, you were just talking about some of the research and the findings that you've seen. Tell us a little bit more about your research in particular.
So I'm proud of this work that we did. You know, we're always trying to take medicine to that next level of care. And so here it is. So out of inner city Dallas, where we're located, we did a survey of 100 women who were done with fertility. They knew, they made that commitment, no more children. We offered them two scripted options: traditional surgery in the hospital like we've just described, or office-based care with no incision and no anesthesia. Well, of course, it's not that hard to believe that over 95% of women obviously chose the minimally invasive option, because that's how medicine should be. Here it is. Best outcome, lowest risk. That's the message I'm trying to convey.
Well, Dr. Chapa, thank you so very much for being with us this morning. Can you tell us maybe a website that we can go to get for more information?
Absolutely. For more information, any patient can always talk to their healthcare provider, their physician, or they can actually go to this procedure's website, essure.com. There's some animation, there's some questions there, and everybody is trying to guide patients the right way, and the way to do that is this information. Thank you again, Laura.
Thank you so much, Dr. Chapa. We really do appreciate it. All right, we're back with more Low Country Live coming up after this break. Stay with us.